Oftentimes, people don't go to the doctor because you're afraid of the expense. So you go to the doctor, you have a simple procedure done, bam, you get a bill for $700. You don't have the money to pay for it. So these are other deterrents that keep people from accessing care. And when you start looking at Black and brown communities, there are a lot of cultural things that go on within our communities that also keep us out of the system. So I'm going to name a few. Anybody in here know Father John? Okay. Anybody in here know cod liver oil and castor oil and some of those other homemade remedies? So when you got sick, you were treated at home. You didn't necessarily rush out to the doctor. And so many people solely rely on that. Listen, this is all I have to do. So again, we wait too long to be diagnosed. We wait too long to get the care that we need. So if you have insurance, you get to keep your insurance. And the subsidies will be available, as I said, to families who meet the 138% poverty line. That's only $31,000 for 4 people to live on. So it's still not a lot, but it's better than nothing at all. And so we have to work to make sure that this is affordable. People with financial hardships will be exempt from this, undocumented immigrants, and people with religious objections. Also, if the cost of your insurance exceeds 8%, you will be eligible for a subsidy. So let's talk a little bit about Medicaid and who does it help. Medicaid helps seniors who are in nursing homes, children who are seeing doctors, disabled people who are attempting to live independently. And so the only provision of the law that was actually tampered with was the Medicaid expansion. And they're leaving it up to states to decide whether or not they want to do that. In Ohio, we haven't made a decision yet, but on November 16th of this year, all states will be required to state whether or not we're going to have a state-run exchange, a partnered exchange, which could be like with Ohio and Indiana or Ohio and Pennsylvania, or whether or not we would have a federally run exchange. Our hope is that we would have a federally run exchange, a state-run exchange, so that we could best address the needs of Ohioans. So the ACA helps communities of color, people who are living with chronic conditions. It helps older adults. It helps people with low income. It helps women, and it helps young adults. It emphasizes wellness and prevention because the co-pays are eliminated for many of the preventative screenings that we go to the doctor to get annual physicals for. It also expands funding for community health centers. And these community health centers will be designed with the people who live in those communities who will consider some of the cultural nuances of that group. One of the other things that I really like about this prevention and wellness is that restaurants will now be required to disclose the nutritional content. So the next time you buy any kind of fast food, look at it. Because McDonald's advertises to all of us that if we buy an Egg McMuffin, that it's about 400 calories, but they don't tell you that it's 1,600 milligrams of sodium. And so for people of color who are sensitive to sodium, we can't eat that. So we need to know when we're making these choices about the food that we're eating, what exactly is in them. By improving the quality, we are going to require, or the Patient Protection Affordable Care Act requires hospitals to do community needs assessments. Now, Director Dawson pointed out this whole business of collecting data on race and ethnicity. Hospitals up to this point have said, well, we don't know who comes in. So if you don't know who you're treating in your community, it's difficult then to address the needs of that community. So they are now required to do race and ethnic data, and it will also provide additional workforce development. So there are going to be reductions as far as the student loans to go back and to acquire new skills. And I'm really excited because I met 2 women the other day who are actually in school learning how to become community health workers. We have submitted legislation to the state what we think this ought to look like. And we're currently conducting a study to find out who is using community health workers, what type of education do they need, how should they be paid. The other thing, too, that helps to reduce payment is preventable readmissions. We've taken people to the hospital for a broken arm, and you go to the hospital and you get a bandage. And then you have to come back the next day because it wasn't fixed right the first time. So now hospitals won't be paid when there are preventable readmissions that could happen. It's important to improve our overall health. I don't want to go to any more premature homegoings or any of those other kinds of things. I want us to be a healthy nation. When you look at other cultures and you see how they value our people, we can look at 2 things that tell how we value our citizens. And that is whether or not our babies are living and how we treat our elderly. And so you have heard already that we are not treating that group of people who are the most vulnerable not very well. So the Patient Protection Act is helping to fight fraud, waste, and abuse in the current system. And so when you go to your doctor, ladies and gentlemen, and they start to say to you, here's a free cooking class that you can take, or here's Silver Sneakers, by the way, is another element of the Affordable Care Act where seniors are now able to go and access the gyms. So there are many things that are here. I brought lots of information for you to review on this. And again, I need you to go out and talk to people. And this won't be your first or last time hearing from me, because we need your voice. In April 2006, Mitt Romney signed into law Romneycare. The Affordable Care Act is modeled after Romneycare. So when he says to you that he wants to overturn the law, what happened? This exactly mirrors what he signed into law in 2006. And so pay attention. Tell people what's going on. Reducing the federal deficit is the right and responsible thing to do, but it should be done based on our priorities, based on the health of its people, not political gains. And so I will close with saying, we who believe in freedom cannot rest. You have to go out and tell everyone about this. You must get engaged. You must raise your voice. So when I call you and say, I need you to write a letter, I need you to go with me on a legislative visit, and it probably won't be except to say hi to Representative Sykes because he's already on board when we saw that. But I need your voice, I need your shoulders, and I want to hear from you. Thank you.